Okay, valuation challenges. I think I'm going way too slow today. Arguably, the valuation challenges, what is the value of the health change that's generated, are just the same that we experience with looking at new drugs. But, as contrasted with new drugs, there's much less use of QALYs in evaluating public health interventions. And I think the reason for this, less use of QALYs, more use of money. I think the reason for this is public health interventions tend to include a broader mix of outcomes. They don't just have a narrow health effect, they have potentially broader effects, as I tried to illustrate particularly with the street lighting at the outset. And so for that reason, that maybe tips the balance a bit. Monetary valuation becomes a bit more attractive as a methodology. Okay. 12 minutes. Are public health interventions therefore different? When I say are they different, do they have characteristics such that our economic methods need to change or be adapted when we are evaluating public health interventions? Now, I say recently, but it's about 2 years ago now anyway, maybe 3 years ago, a working group was set up by the Department of Health in England to explore this question, specifically in the context of vaccination programs. What had happened was there had been a lot of publicity about decisions about vaccination programs, particularly meningococcal B vaccines, and as a consequence, there was a lot of questioning about the methods used to establish cost effectiveness. Now, the methods used were just exactly the same methods we generally use when looking at a new drug. And in this case, however, there was huge public concern. I don't know if you have something similar in Japan, but in England, if people, the general population, don't like something, they can set up a sort of opposition campaign to the law and collect signatures. And if you get above so many 100,000 signatures, Parliament must at least look at this concern or complaint. Well, in response to the initial decision making on Men B vaccine, they got the biggest ever list of signatories saying we don't like this decision. It's called a petition. And so the House of Commons Petitions Committee then looked at this. And so as part of that, there was a desire by the Department of Health to have a working group to establish, is it appropriate to use standard economic methods to evaluate vaccination programs, or are vaccination programs somehow different? And in their wisdom, the Department of Health made me chair of the committee, which was a great honour, but with hindsight, I'm not sure I should have said yes. So we had about 13 meetings. We had 3 subgroups, and the subgroups reported to each meeting, and then eventually we reported ourselves. But terms of reference are there. But basically the question was, should we be using different methods of evaluation or similar methods? And we decided that CMIP was the acronym for the working group, that there were 5 potential methodological issues. There was issues, unsurprisingly, around measuring and valuing health effects. There was issues around discounting and the time horizon. There was issues about what we call non-linearities in the relationship between cost and outcome. I'll explain these once I get to them. There's some question about treatment of uncertainty, and then a question about the cost-effectiveness threshold. And just a little bit on each of these. So measuring, valuing health effects. Clearly, a lot of the health benefits are directly to those people who are vaccinated, because they have better chance of avoiding disease. But there's also going to be benefits, and this does make vaccination a little bit different, benefits to non-vaccinated people, because they will face a lower risk because other people are vaccinated. So other people getting vaccinated gives you a benefit. You don't have to be vaccinated yourself to get a benefit. This is, in economic jargon, this is called an externality, and we always, in health context, use vaccination as an example of externality. There was a great deal of discussion about something called a peace of mind benefit. Partly to vaccinated people, but also to the families themselves. The idea here being that just knowing that your child, for example, has been vaccinated is going to give you peace of mind. And that should be valued. Men B is quite possibly a little bit special here. Your young child can be seemingly perfectly healthy in the morning, and in extreme cases, and I stress it's extreme cases, they could even be dead by the evening. But that's really extreme, but it can happen. And so parents were arguing, this is a sort of terrifying disease. There's a vaccine that works quite well. It's not that great, but it works quite well. Of course, we must have it. And then they were arguing, it gives us peace of mind. And they're saying, well, your economic evaluation doesn't allow for our peace of mind. So that's the sort of argument they were making. So they're really saying vaccination, or this vaccination, is different. Our working group looked at this very closely, but didn't buy it really. We argued people have peace of mind from knowing there's an accident and emergency department nearby. People have peace of mind from knowing that if you have metastatic renal cell carcinoma, there are 4 or 5 treatments available that you could have access to. So we argued that there wasn't something completely different about vaccinations. This was a healthcare broader phenomenon. The question arose, are some QALYs from immunisation, are they worth more than non-immunisation QALYs? Now the way the patient groups were talking is as if they were worth more. And so whatever the estimate of QALYs was, QALY gain from a vaccination programme, we needed to sort of scale it up because some of these QALYs were more important. Now it is true that frequently immunisation programmes are directed at young children. And it is true that it has been argued that benefits to young children are more important than benefits to adults. Now, as I said, I lose track of which day it was, but it's probably Wednesday. There's this quite long list of reasons, Wednesday morning probably, why a QALY may be worth more in some circumstances. And one of the reasons that's put forward is young children.